And so we had these four major challenges to tackle at once: lack of data, lack of understanding, lack of financing, and a lack of motivation.
Over 350,000 apps in the App Store. Most of them only have 10,000 downloads at best. Pharma's give or take have about 65 plus apps each. Thousands of apps by insurers. Every wearable has a different app, and it needs to have a different app currently in order to be able to connect.
From the very beginning, we understood that every country will try to become sovereign when it comes to their data, their patient data and health data.
There is no pharma in the world that has every single therapeutic area in their portfolio. It doesn't exist. So, of course, they were building solutions for their therapeutic area. This is just reasonable. We are living right now, it's a generational transformation. This is the greatest thing that has ever happened in health in an extraordinarily long time. Quite often in big industries, people don't change because they want to, they change because they have to. This wild west, of AI, this wild west of applications, it's gonna get structured because the future is gonna be, more governance, right? This is an opportunity. And this is why when you do things the hard, the slow, the expensive way, right? This is what it takes, no shortcuts.
Welcome to Healthy Voices, Rethinking Health. I'm Grace McNamara, and alongside Ofir Ejnes and Jean-François Legourd, we host conversations and guests connecting the ecosystem of health. We talk business and technologies, we explore opportunities and challenges. Welcome to the conversation. So let's just kick off. Maybe Ofir, over to you. I mean, you started this 5 years ago, right? There's obviously a vision and a problem you saw in the marketplace that you were starting to solve for together. So lay it out for us. What was the vision? What was the problem? And what's happening currently in the market that's solving for that?
Sure. So I guess that, very selfishly when I was diagnosed, right, with my chronic conditions, I just downloaded the apps I was supposed to use because I like to think I'm healthy. I had on top of those apps, one per condition. I had, of course, a sleep app. I had a nutrition app. I had a meditation app. I had a sports app. I was running 13 apps in parallel, which was absurd. Just, from a very, I want to say a patient-centric perspective, I just needed one tool where I can see the entirety of my data, because you don't exactly need a PhD to understand that if my data is cut into so many pieces, how can I have an accurate picture of what's happening with me, right? So I'd say the starting point was really just realizing that there was this absolute mess, right? More than 300,000, health apps on the app stores. I said, this makes zero sense, right? So the first thing was to solve for the pain of this fragmentation and to provide for a better solution, for patients. And it's interesting because just to jump forward in time, right, a little bit to today, I mean, we're still very much today going through, again, this, I want to call this a Wild West situation, with the AI. Today, you have the exact same thing. There's basically, everybody's very excited. There's very high, quick adoption. There's zero regulation. Nobody asks any question. Data privacy is starting to show up and going, what does it actually mean? And we're going, again, maybe we need a bit of a framework here, right, to make it work. So I think that healthcare is going through right now to two things. Actually, it's going through a bubble, which we all know, and also a Wild West phase. And I think it will mature into a structured and compliant ecosystem. And I think that our vision from day one was to build that layer, but connecting it through the patient, right? That's what we're really trying to solve for. But obviously, I have a ton of stuff I want to say, but I'll pass it to Jeff.
You said it quite well, Ofir. There was a fragmentation, a lack of data, and whether it was missing or fragmented, there was a headache with all these apps, and whether they were consumer-facing apps or B2B professional apps. There was a couple, three more obstacles that we were finding at the same time that were preventing patients from taking control of their health and driving measurable impact. There was a lack of understanding. People don't have a PhD, literally, and when it comes to science and medical science, having medical understanding is not an easy task to put on every citizen around the world. There was a lack of money, but can understand you don't have the money to finance what you need to access. But really, really at the core, and Ofir was very strong on that. Although I had my contribution, there is a genuine lack of motivation to do what's good for you for the long term. And many apps that existed in the market were very transactional, very rational apps. So it convinced only two types of people: the one who wants to live very, very long, and the one who are very, very sick, which is for the 95% of the fat middle, the emotional connection to your long-term benefit was missing. And so we had these four major challenges to tackle at once: lack of data, lack of understanding, lack of financing, and a lack of motivation if we wanted to make a dent. And AI today is helping to tackle a few, but not completely, but still a lot easier than what it was 5 years ago.
Yeah, some of those stats are stark, right? There's over 350,000 apps in the App Store. Most of them only have 10,000 downloads at best. Some of the stats I was looking at, so pharma's give or take about 65 plus apps each, right? Thousands of apps by insurers. And as we were saying, Ofir as well, every wearable has a different app, and it needs to have a different app currently in order to be able to connect and so on. But we also know that we're not, as you said, JF, we're not seeing a healthier world. So what's the solution? Obviously, you guys have been building an infrastructure. So maybe JF, the infrastructure here is important. We've talked about clinicians. We've talked about the person on the street. We've also talked about pharma, like about insurance, wearables. Part of the challenge here is everyone has different incentive and different business model. We got to bring it together. Otherwise, we're going to end up with the same fragmentation we've had for the last 15 years. And AI helps us change this, right? So give us kind of the architecture, the infrastructure, the orchestration layer. How are we going to solve for this at mass?
There are probably at least three layers to address. One is and I'll go back to what I started with motivation. There is a lot of similarities on what deter people from taking care of their health across the world. There is actually a lot more variation within a country than there is between countries around the world. So the first thing that we have to understand is how to segment the psychology of the users in order to get them motivated more than the baseline to take care of their health. So the first layer that we had to do is segment by health profile and health objectives and digital savviness, the willingness. Not digital savviness, do you know how to go on Facebook or on Google, but digital savviness in the sense of how much do you want digital intervention to support your health journey. That was the first very strong user, patient-centric. And when I say patient during this meeting, I mean healthy patient and sick patient. Everyone for us is a patient. Prevention is being a patient in your health. So it was that layer to address, and we realized that there was a lot more diversity within the country. We launched two very different countries on day one, Brazil and Vietnam, and quickly after we were in the UK, in Turkey, and in Egypt, very different. That was a fundamental layer, was understanding human psychology and our limitation as human beings. The second layer was more on, and it was accelerated with the sovereign aspiration, the way data was built at Healthy. From the very beginning, we understood that every country will try to become sovereign when it comes to their patient data and health data. So we needed to be addressing two challenges here. One is to make sure that we can deploy a global company and a global infrastructure while having the data that never leaves the country. So how do you operate a global, local data infrastructure? That we can have a full conversation on that, but that we knew it from the very, very beginning. And third, which is not the last, is making sure that we were not trying to build another silo inside that very fragmented industry, which means from the beginning, we needed to be open. Open meaning any device. It means any doctor. It means any healthcare provider or lab result provider. It means any medication and no medication. It means as well, any person can be controlling their own data and share it or not with anybody. So that notion of being open and avoid creating another siloed where you have the best app, it's just you can't leave it. That was what the fundamentals were at the beginning of a global health platform that was locally aware.
Yeah, I just want to double click on something, because I think that one of the things that were really fundamental of the company, right, is that there was also an understanding of how we got there, right, with this fragmentation. So for instance, right, there is no pharma in the world that has every single therapeutic area in their portfolio. It doesn't exist. So of course, they were building solution for their therapeutic area. This is just reasonable, right? Unfortunately, right, the comorbidity rates being gigantic, right, you ended up by forcing the users, to be fragmented. So I think that in that order, the understanding that we had that you have to have several large pharmaceutical, each contributing their therapeutic areas inside the same application, making sure that we follow the guidelines of each country and the best practices and the way the patient enters the data, which makes it useful, actually useful, you know what I mean, for the HCP when it's presented to it. And then to the point of engagement, making sure that it is sponsored by this industry in a way that we never monetize the patient, which is, again, a big separation on the way most apps operate today, is that we give it away, right? To make sure that people remove all the barriers of entry, like Jeff was starting to list them out, right? Is that it's free. You have all your conditions, all your therapeutic areas, all your wellness apps inside the same application with serious gamification applied to make sure that you do have that motivation aspect integrated inside that application. That was a big, big, big fundamental piece. And we can understand why the industry was there. Now, once that's said, right, and you understand that this was the only way to build this, you also understand why we had to do things the hard way. Right? Because what Jeff started saying, which is an interesting parallel what I was trying to say before with the Wild West notion. So, you know, the reality, pharma is ultra regulated, right? So when we work with them, meant that we had to make sure that we respect all the highest standards, whether of privacy, of data structure, of the way the data is, again, structured and presented and analyzed. We had to follow everything. And it took us years, right, to get to the level that we have today. And this is why, and I think this is what you're going to see in AI as well, this concentration of data. I mean, like I said before, it's obvious that's the only way. That's the only way that you can have a diagnostic that means anything, right? Is when your data is inside the same place. And for the AI, again, intelligence is going to become a commodity. All the LLMs, they're all going to be, you know, every few months, this one will be better than this one, will be better than this one. This is going to become, again, and the agents are going to go in the same direction. Right. The thing though, and this is where it gets super interesting, is that you're going to need that one spot, where the data is structured in a certain way, where it can actually be useful, where it can be analyzed in a way that makes sense. Because today what's happening, everybody's opening, you know, their LLM of choice, they upload some piece about themselves and go, what have I have? Right? What should I do? Right? And of course, this is a very myopic picture of whatever it is you got going on. Right? Now, that I think is something that we are fighting really hard to solve for. And I think that's a big, 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 big piece of what we do. Now, I do want to touch for a second on the motivation aspect, right? So the motivation aspect, here's a really interesting thing. We are living right now, you know, it's a generational transformation. This is the greatest thing that has ever happened in health in an extraordinarily long time. You know, we never had an option, you know, to empower, you know, the patient in a way that we have right now. This is fantastic. This is democratizing health. This is fantastic, right? Now, here's an interesting thing, especially when you look at the legacy players. And here I just want to highlight, you know, the insurer and, you know, the medical profession, the HCP. Let's start with the doctor. The last mile is human. I'm not going to prescribe myself, right, my medication. So this means that here, the opportunity for us, and this is where we double down on our strategy of partnership with the pharma industry, because that is the only industry that is built for the last 100 years relationship with HCPs worldwide. They have that relationship. And this is why we believe that they were the right partner, you know, to launch this revolution. And I think that you understand, because essentially they have obviously the biggest expert in every single therapeutic area working for them, right, directly or indirectly. And this is why when you go to the world of insurers, how does it make sense that every insurer is going to start recoding every single therapeutic area better, you know, than the people that have been doing it? That just makes zero sense. Doesn't mean people didn't try, but it makes zero sense. So that means that our logic of building the solution for the insurers on top of what we have built with pharma is natural, because obviously, right, here you have all the expertise concentrated more than we'll ever have. Right. And they have, back to the incentive logic, the insurers have a very powerful tool there, because they can create the incentive layer that can have impact on premiums, that can have impact, you know, different levels of care based on the way people behave. But what was missing again for them was this very holistic layer, right? Because again, it doesn't work if I cut you into small pieces. So I think it was this understanding that the solution will come from the legacy players, but it will only work if you actually create a common denominator between them within the industry. And I think that this is where we put our efforts.
It is where the power lies, isn't it? I think we're in a phenomenally different time where we have the ability to assess and track and trend way more than ever, but the data has to be together. As he said, the silo does not benefit anybody. The doctor isn't able to diagnose or treat without having that comprehensive data set. One of the stats here is that 4.5 billion is spent on a digital transformation by pharma alone annually. So they are trying to upgrade their technology, but going back to your point is unless they do it together, because no one pharma owns the entire system. And, you were a good example of Ofir. You have multiple medications, you have 13 apps. And that's the average patient today. They have, give or take, 10 plus apps. And they also have more than one condition and more than one medication. So you're really at a complex, it is a complex system. So we have to simplify it by putting that architecture together. And Jeff, I know you've been fundamentally shifting the landscape here of pulling together everything from skin health to mental health to physical health to medications to being able to cater for the HCP, to understand what they're prescribing, who they're prescribing to, and who's actually adhering to lifestyle changes alongside adherence to the medications. Insurers don't have the data typically to be able to properly assess and underwrite the risks. If they don't have the data, then they're going back on averages, which not everyone is in that bucket. Jeff, as you look at the industry, what do you think is the greatest benefit to insurers and pharma? Like if you're like the CEOs listen to this, what are they thinking? What are they going to be changing, and what's the big impact for them?
I'll take it separately because pharma and insurers, although they work in the healthcare continuum, they're facing the patient and the burden of chronic diseases differently, or the burden of deteriorating health and lack of incentive of preventative health in a different way. From pharma standpoint, even if they spend a lot of money, pragmatically speaking, pharma has spent less than 1% of their whole marketing and commercial and medical affair effort on patients. Less than 1%. 85% of pharma expenditures goes towards HCP communication, around 15% towards the public payer and the private payer, and less than 1% towards the patient. What is changing there is you start seeing clear players that are getting completely significant traction compared to any traction that pharma has ever had when it comes to engaging patient, number one, and engaging doctors. Number two, with platforms that are centered on the doctors, whether it is doctor education or it is now doctor visit transcript or evidence AI generated search, we see that the relationship with a doctor, which was a prerogative of the pharma industry, is actually melting like snow under the sun. And so now what is really under consideration for the pharma is two things. One is they never really had a relationship with the patient, and the patient is becoming more and more active in the management of their health. And two, they had a relationship with a doctor that is disappearing, reducing and being challenged heavily because there are better sources of information, better touch point of engagement. And the regulator in many countries is actually even banning pharma from engaging the way they used to engage with the healthcare community. That is just the landscape in which pharma operates. Truthfully, pharma wants to invent better molecules in order to have meaningful medical impact. That hasn't changed. We should not look at the H line of the pharma headlines, but we should look at what they are doing 99.999% of the time. Meaningful scientific work. So that's one dimension. For the insurer, is really country specific. You have the fragmentation of the insurance industry in the US where there is no such a thing as one insurance. You have tier 1 health insurance, tier 2 stop loss. Everyone has a fragmented view of a patient that they don't actually even have a direct relationship with. Many employers provide the insurance. So there is a fragmentation, and that is not changing. Insurers are getting more and more disintermediated from the patient themselves. And the type of digital transformation they go through is improving the claim process and trying to have some level of health impact. The notion of underwriting health in many countries is actually banned from insurers to price by risk.
Yeah, community rating, right?
Exactly, community rating or mandatory coverage of certain conditions. So now the question is no longer about how do you discriminate the one you want to insure. How do you discriminate the pricing before you have a healthy or unhealthy patient that becomes insured? But much more, what do you do with that patient now that it is on your book? And so they're looking at how do I engage with that population that I don't have access to? And how do I provide an experience that is not simply about filing claims, but having a meaningful impact on health? And truthfully, it's not their fault. A lot of people of the digital world came with snake oil marketing apps or marketing tactics that either didn't have an impact or had a great impact, but the cost of impact make it completely unscalable. And here I'm taking it I will never mention negative names here, but you would have marketing oriented platforms that are rewarding you for walking, that only attracts the one who wants to be rewarded for something they already do. Or you have very advanced care pathways for acute diseases where the digital plus human intervention makes amazing sense, but is at the cost of $1,000 per quarter or per month, more than the price of the insurance premium. So finding new models to proactively or reactively engage on care at scale is what insurance and payers are facing.
And I know you saw this at Samsung, and I would have seen it at Apple as well, right? As in the evolution over the last 15 years, there had to be a fragmentation as apps were starting. We had to focus, and I'm sure we all had the same, as focus and do one thing really, really well. And the phenomenal difference now is you're like, don't do one thing. You've got to be comprehensive. You've got to be able to connect these dots from doctors to patients, to members, to employees, to whether you're on medication, to whether you're insured. They have to be connected. The ecosystem is really coming together. And I mean, I'm excited about where it's going for sure. And thankfully, from a selfish perspective with women's health, I'm excited that we're finally going to have an awful lot more tools and diagnostics and medications. And also the rare disease space, going back to your point about pharma, like it's really hard for pharma to find patients who have rare disease, which means it's really hard for them to have clinical trials. It's really hard for them to build that data set in order to build tools efficiently as well as feasibly to get them out to the world. So, yeah, people are in need of personalized and precision medication. And then, hopefully we get to the point where we can underwrite the risk more personalized because the data exists in order to bring it to market as well. Ofir, what are you seeing? When you look at the world of CEOs of pharma and healthcare and insurers, what are you thinking is the one or two big ticket items that they're thinking and need to be talking about today, not in 5 years ago, but today in order for the next 5 years?
I think that Jeff alluded to it. Quite often in big industries, people don't change because they want to, they change because they have to. The reality is that there is tremendous regulatory pressure, on the pharma front, and there is tremendous margin pressure on the other end, in the insurance companies. So there is a necessity, to create, pathways, new models, to address this. I think that this is not just a transformation. I think this is an opportunity for an upgrade. And this is the way, right, we choose to look at it. I think that like we said before, right, on the whole health journey, there's an opportunity now to basically provide much more efficiency to the provider and much more empowerment, to the patient. And I think that CEOs in the pharma industry are very conscious of that. And that, by the way, of course, there's a specific type of pressure today on general medicine versus specialty care, right? And today, I think accompanying this transformation, is something that obviously we're very close to. And I think that, another thing that's close to the hearts, I think, of the leaders is the science and the data. Today, this is an industry that's driven by, medical publications and rigorous science. Today, again, this fragmentation didn't exist solely on the patient front. This fragmentation exists on the data front by definition, right? So, which means that today we still live in a world where whether it's RCTs or RWEs, they're extremely slow, they're extremely expensive, which again drags the entire industry with it. Now, if you're looking into a world where everything's in the same place, right, structured in the right way, you can be extraordinarily faster, extraordinarily cheaper, and you can progress science faster, right? So I think, like I said, this is an opportunity for an upgrade across the board. So that's quite clear. I think on the other front, for the insurance companies, again, there are two things today. I think one, there is margin pressure, right, which creates the necessity, right, of making the population healthier because the health things just keep going up. I mean, that's not a big secret, right? They're just exploding. So how do we keep that under control? So we need to there's an opportunity creating incentives, right? Not by punishing users, but literally by giving them opportunities, right? And, controlling their costs, optimizing their costs, and most importantly, having better health outcomes that can be created, which I think are, they're very, very front and center for the insurance companies. And I had another point that just escaped my mind, but I'll get back to you in a minute, I'm sure. So I'll let Jeff say something smart.
No pressure, Jeff.
No. I think you covered a little, but I think it's. I don't want to repeat what I said about what's top of mind for CEOs, both in our partner, because for us, leading a company is we want to be addressing the pain point of the people that we support. We support the patients, but we support the CEOs and the C-suite of our clients, pharma, insurers, and to a certain extent also Minister of Health, which are in charge of the chief medical officer of countries. And in many countries, the public sector is driving and leading the innovation. You've seen what they've done in Brazil with the United Coverage that is providing tools for doctors to manage better the visits and the consultation with their patient. We've seen in a lot of countries where the public sector and the governments are actually the main innovators. And it's there for us is what role do we play, if any, in that ecosystem?
Can I just close it? I remember the point that I wanted to make. So this way, I can add Alzheimer to the list of things, that I'm tracking. Anyway, the thing is that I think what's very much on the mind of leaders, in the insurance industry, is that today in many, many countries, if you have a precondition, you're denied coverage, as an individual, and that's not an insignificant statement. So in many countries, let's call it for what it is. People don't necessarily say what's exactly happening to make sure that they have the coverage, right? Which creates its own set of problems, right? So today, I think that the opportunity is to offer coverage to those people, which grows the market size, but asking them for life compliance. And I think that this is something that today is going to be, taking us slowly towards value-based care, which is where this needs to go, right? Obviously. But I think there is a new type of contract that's going to, appear on the market where if I accept, to follow a certain, regimen in my life, I might be entitled to a certain kind of coverage and support, when I don't. And I think that that's a massive opportunity for the industry as a whole, and it's becoming very clear for everyone. But again, in order to do that, by definition, you needed to find a way to have one platform that can do it all, because if not, the diversity in health is too gigantic. So again, this notion of creating, for lack of a better word, a health consortium around this platform was the only way to get there.
But trust is a massive factor here, right? Why are we trusting tools like Elfi's AI and LLMs when it's a bit of a wild, wild west around where my data sits? So maybe JF, over to you first.
Yes, of course. So trust is always relative to what is your next best alternative. When you realize what patients are facing, they are facing, what is commonly known in the industry, Dr. Google. So they relate to what they have access to. Patient, they have access to limited, standardized, static information that is written in a confusing format. And so when they see the LLM reacting to specific questions, they see human language, quoting specific sources, responding to specific personal questions. So that generates a certain level of trust because the LLM is empathic, positive, actionable, but indeed, historically prone to hallucination and more accurate. But it is still better than no information whatsoever, at least in the eye of a patient. Now you go to doctors. It's true that doctors are rightfully much more demanding, and they have to. The tools, however, are becoming more professionalized. And when you see the latest platforms that are being created, and Elfi will announce soon, is when you get the models to sync and to index only validated scientific publications, medical journals, national health guidelines, you start reducing greatly the hallucination to really the latest and greatest piece of information. And doctors sees it. So in many ways, LLMs right now are providing the doctor a much faster way to get to the latest pieces of information. And doctors are no fool. They have limited amount of time themselves. Whatever provides fast and sufficiently accurate information, they will adopt. The LLM today for doctors are capable of giving significant results. Many of these tools have even managed to get the medical degree, at least on the theory, and doctors are capable of punching back in case the data seems to be going in the wrong direction. So trust is being built right now.
And that's something I definitely want us to come back to, Jay, and another talk is where we can go into that depth. Because to your point of it's possible, and we have some of the tools, we have some of the credibility with it, but it's definitely not fully understood.
I agree, but I have a little bit of not a different take, but I think I look at the situation a little bit differently. I think back to what I said before. So the industry, the health industry, was built on a quite solid concept, which is we have amazing AROs, then research organizations, the famous institutions. We have amazing KOLs, very famous professors that that worldwide share their knowledge, and we have amazing conferences, where both get together and are presented to the scientific community, to doctors to build the trust, right? And the entire pharma industry was built on this concept that you go to a very famous ARO, you find a really famous professor, you do very rigorous publications, and then you present the results of those publications to the HCPs that you want to show the new path, maybe a new medication or whatever that is. Now, I think, like I said before, I think we understood that this is definitely the way to keep the LLM honest, like Jeff just explained, because you don't answer what you think. You can only give me that answer if you can reference a very clear publication on one of the notorious websites where we have them. And for companies like us, right, we made it a focal point that we play exactly in that sandbox. So first of all, if you look at the 300,000 something apps out there, not that many have medical publication just to start with, right? So we went engaging the biggest AROs in the world, some of the most famous professors in the world. We publish RWEs, we publish RCTs, and these are the publications that we share, with the HCPs to gain their trust. Because again, that's a mental model that they're familiar with. As you know, one of the biggest problems today is that every time you're trying to be a little bit too smart, oh, look, it's great, it's whatever, you're out of my traditional workflow of validating information. I don't know what to do with you, right? Because again, today, I think a little bit like in advertising, everybody suffers from excessive amounts of information being projected at them. So I think for doctors, it is fundamentally important, that we follow the same rigorous approach. But again, the opportunity today is that we're going to be able to do a lot more of these publications to verify and to prove to them that we did follow the famous professor, the famous ARO, the most rigorous, methods, for those publications. And this is how you're going to build trust. You're going to build trust on the LLM by referencing those studies, and you're going to build trust by providing these new studies that demonstrate that digital therapeutics are real, right? That software can have an impact. And I think this is how you're going to transform, eventually the industry.
What's nice about that as well is the transparency. And when you have multiple players at the table, using the same ecosystem, you can be transparent. And I think that's an important piece to as you said, as you're going to build trust with the complexity of data and apps and AI and LLMs. The transparency of how it all clicks together is necessary. And I think that's one thing that Alfie does quite well is, you can physically demo to a pharma, or to an insurer, or to a data scientist, or to a researcher, or to a doctor. Here's how this works. Here's where the data is taken from, the advice and whatnot. It's quite transparent, which I think is critical for trust going forward.
100%. Because again, like you said before, the vast majority of apps out there, they got what, 10,000 users. If you actually take the trouble of reading, those medical publications, some of them are not that strong, the way they were built. So that's why when you're putting yourself through the ringer, because we have literally, some of the biggest pharma companies in the world as partners, the standard at which they hold us forces us, to have a scientific method that cannot be disputed.
Yeah.
So this is how you build trust, right? Don't try, you do what everybody did before you, and you apply yourself, to the same standard. And again, I think that back to what I said in the beginning, this Wild West, of AI, this Wild West of applications, it's gonna get structured, because the future is gonna be, more governance, and more structure if you want impact, right? It's not less, it's actually more. So I think, to your point, this is an invitation to build trust, to bring structure, to be compliant, to protect data, to do all these things, right? This is an opportunity. And this is why, you know, when you do things the hard, the slow, the expensive way, right? This is what it takes. No shortcuts.
Could be a mic drop moment there. No shortcuts. I love it. GF, any final thoughts before we wrap up this one? I know we've lots to discuss on many more podcasts, but any final thoughts for today?
You know, when you look at trust, if you want to change human behaviors, you need to look at motivation first. And what pain point is it really addressing? You can spend, and I think you have great digital therapeutics companies in Europe that has more clinical publication than anybody else, but they did not monetize and they didn't get adopted. The whole digital therapeutics industry in Europe and even to a certain extent in the US is not working. Because even if they have trust, they don't have adoption. And they don't have adoption because they're not solving an actual current pain point and not looking at the incentives. User incentives, short-term versus long-term health benefit. Doctors are solicited by everybody. They have to comply with everything. I'll look at, if we want to build trust, we have first to build usefulness that builds adoption that brings impact, and impact that has the right discipline to then become authoritarian ways of working. And at Elfi, we did both approach. We started and we were invented in dispensaries in poor rural areas in order to get the validation, the adoption, the traction, the real world data to demonstrate the impact. And then immediately, in parallel to that, we launched the randomized clinical trial. You need to solve a real issue and make sure you adopt it fast. Otherwise, innovation does not matter.
It's an interesting space, right? We have a consolidation of apps and platforms. We have a consolidation of data. We've obviously seen M&A happen in pretty much every industry, and it's happening now in health faster than I think any industry in particular. And connecting the ecosystem is just absolutely critical in order for the end user on the street to understand what they need, which also connects to what the business case is for the HCP, is for the pharma, is for the insurer, employer, and everyone else involved in the ecosystem. So the good news is it's a consolidation for better quality. So it's less quantity, better quality, better outcomes. And I think it's a phenomenally exciting time for anybody in the health industry. And I think we're going to have we finally have a way to get towards value-based reimbursement and precision healthcare. I think we've talked about precision healthcare as well for 10 years, but realistically, it's not something the average person would experience. So it's an exciting time. And I know we want to talk about governance and regulation at another time because there's a lot in that, especially when you talk about, as I said, different markets, Europe versus US versus Asia versus Latin America. There's a very different landscape. So we'll come back to governance and regulations because these partners and these players are global and it's a global ecosystem in health. And we have the ability now to connect it more than ever. Exciting. Great. Thank you, guys. Thank you for today. And we shall look forward to the next conversation.
Absolutely.
Thank you for listening to Elfi Voices Rethinking Health. We invite you to connect, share, and subscribe. Until next week, stay curious, stay Elfi.